Health officials are warning people who are infected with monkeypox to stay away from household pets. That's because it's possible for people to spread monkeypox virus to animals. Dr. Kumar with Austin Gastroenterology joins us this morning to talk more about this. Good morning.
Good morning, Casey. Good to see you again.
Thanks for coming, Dr. Kumar. So how uncommon or common is this?
Well, there's only been one reported case, but it's just proof of concept that we ought to pay attention to. This was a case published in The Lancet, the British Medical Journal, so a credible journal, and it documents a gay couple in France who both at different times were infected with monkeypox and who had a dog that they slept with in their bed. And, the dog tested positive for monkeypox as well. And so this is the first clearly documented transmission of monkeypox from a human to a dog. Now, zoonotic viruses, meaning viruses that exist in animals that are able to transmit to humans are known. That's what the entire coronavirus pandemic was. It started in bats and evolved to infect humans. And now this came, from monkeys in Africa to humans, and now from humans to dogs. And so it's just the idea that we can transmit this to other species other than humans. We should be aware of that. And so as this monkeypox grows across the country and across the world, we should pay heed to the risk we're exposing our pets to.
Yeah. Well, still talking about dogs, but kind of not even talking about dogs. What's the latest of how this thing can be transmitted? Because obviously this dog must have got it from a surface, from the bed.
Yes.
Can humans get it from sitting in a theater seat or a restaurant seat?
That's a very good question, and I don't think that's going to happen. I think that this is going to be direct human contact, human to human, intimate contact. Sure, it can be spread through respiratory secretions, so that's still close contact, but it's not as infectious in that regard like COVID was, right? It's not that infectious respiratorily, but certainly there's the opportunity. The major source of spread continues to be intimate contact, not necessarily sexually transmitted disease. It's not that, because it doesn't require sexual activity. But, bed partners, people that are in close proximal contact, particularly if you have the rash, and that rash is an open sore, and you touch somebody else, that's where the most of the viral particles is in these rashes. And so currently it's kind of navigating its way through the gay population, but you can quickly see how that could spread to other populations as well. And now there's over 1,000 cases in Texas, over 12,000 cases in the US. So this is proving to be a highly contagious disease. I remember several weeks ago, you said, how worried should I be? And I said, I put it on a 2 scale. I kind of changed my answer now, put it up on a 3. And the only reason I bump it up is how prevalent it is. I'm going to stick to my guns about the concern, because it's not like what we've just been through. The pandemic killed over 1 million people, and very, very few deaths have been reported with this. So I kind of compare how worried we should be with the eventual outcome. Certainly, you don't want to have this rash. You don't want to have monkeypox. You want to kind of nip it in the bud and not spread it any further. But, most people aren't going to die with this. And so that's kind of where I come with my relative level of concerns.
Good info as usual. Dr. Kumar, thank you so much. If you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. And you can check out his website, drkumar.com.